Joint pain, be it the hip or knee, is very debilitating. There are patients that I see that cannot even walk a block.
It could be simple things like getting in and out of a car, or going upstairs or downstairs, or getting in and out of bed.
Those things that we take for granted just by getting up and starting our day, many of these patients with arthritic hips and knees aren't able to perform those activities.
The vast majority of people who have true arthritic disease, if they're going to have a surgical procedure, it's going to be some form of joint replacement. Hip replacement and knee replacement, they transform lives. It's freedom from pain, and for me, that's the most rewarding thing I can do.
The last 30 years of my practice, I've seen a great change in orthopedics. The Northwell Health Orthopaedic Institute has a very collaborative team of surgeons, and it allows me to do what I want to do, deliver a high quality of care to my patients.
We offer all treatments here, including anterior hip replacement, total knee replacement, gender-specific knee replacement, and computer-assisted navigated knee replacements.
We also do partial knee replacements. Sometimes you don't need to sacrifice the whole knee. You can take care of just the disease portion.
You know, what the challenge is, patients come to see me and they have an arthritic knee. It's been painful for years, and I've always wondered what held them back from having surgery. And many times as I interview these patients, they say, you know, Doc, I'm just so concerned about, you know, the surgery. You know, it's a big incision, the recovery period. And the beauty of what's evolved is that we have now the ability to perform the surgery through much smaller incisions.
I'm really excited about the way new techniques and technologies can help us to make this operation as reliable as possible. So whether we use navigation or custom jigs or robotics, all these technologies exist to help us be precise in our surgical technique. We can get healthy, active patients up and moving faster now than ever before.
We have what's called a rapid recovery program with our physical therapists, the ability to get these patients up the same day of surgery.
Northwell has really revved up their home care, so patients that are discharged from the hospital are met by a physical therapist at home for 14 consecutive days.
I have the gift and the privilege to change people's lives.
That's what gets you waking up in the morning and coming in excited to make a difference.
I'm happiest when a patient comes in and says, Doc, I'm happy, I don't have pain anymore. And they're smiling. I said, that's the biggest, you know, reward to me. It's a smile on your face that you've now made your grandson's wedding and dance with him. And that gives me such great reward and pleasure.
One of the most common things that I get to hear every day in my career is, Doctor, you changed my life. And that's really awesome.